COPD, Understanding Symptoms and Management. Welcome back to HealthSphere. Today, we're focusing on a significant respiratory condition that affects millions worldwide. COPD, or chronic obstructive pulmonary disease. COPD is a progressive lung disease that makes it difficult to breathe and is a major cause of disability and death globally. It's a term that encompasses a group of lung conditions, primarily emphysema and chronic bronchitis, which cause airflow obstruction and breathing-related problems. Understanding the symptoms of COPD and how to effectively manage the condition is crucial for those affected and their loved ones. While there is currently no cure for COPD, proper management can significantly alleviate symptoms, slow the progression of the disease, improve the ability to remain active, and enhance overall quality of life. What is COPD? The impact on your airways? COPD is a chronic inflammatory lung disease that obstructs airflow from the lungs. The damage to the airways and air sacs within the lungs is typically caused by long-term exposure to irritating gases or particulate matter, most often from cigarette smoke. In a healthy lung, the airways and air sacs are elastic and springy. When you breathe in, air flows freely through the airways into the tiny air sacs, which inflate like small balloons. And when you breathe out, the air sacs deflate, and the air is easily pushed out of the lungs. In COPD, this normal process is impaired due to chronic bronchitis. The lining of the airways becomes inflamed and thickened, and the lungs produce more mucus than usual. This excess mucus and the swollen airway walls narrow the passage for air, leading to a chronic cough as the body tries to clear the airways. Emphysema. The walls of the air sacs are damaged and lose their elasticity. This causes the air sacs to become enlarged and fewer in number, reducing the surface area available for oxygen and carbon dioxide exchange. Damaged air sacs also trap old air in the lungs, making it difficult to exhale fully and get fresh air in. Most people with COPD have a combination of both emphysema and chronic bronchitis, with the severity of each varying from person to person. This damage to the lungs is largely irreversible, meaning the airflow obstruction is chronic and progressive over time. Recognizing the signs. Common symptoms of COPD often develop slowly, and symptoms may be mild at first, particularly in the early stages. Many people may not even realize they have COPD until the disease is more advanced and symptoms become more noticeable and begin to interfere with daily activities. Symptoms tend to worsen gradually over time and can also have periods of sudden worsening, known as exacerbations or flare-ups. The most common symptoms of COPD include shortness of breath. This is often the first symptom that prompts people to seek medical attention. Initially, it may only be noticeable during physical activity, such as climbing stairs or exercising. As COPD progresses, shortness of breath may occur with less exertion or even at rest. Chronic cough. A persistent cough that may produce mucus. Some people may dismiss this as just a smoker's cough, but it's a key symptom of chronic bronchitis. The amount and color of the mucus can vary. Wheezing, a whistling or squeaky sound when breathing, particularly during exhalation. This occurs due to narrowed airways, chest tightness, a feeling of pressure, squeezing, or heaviness in the chest. As COPD progresses, other symptoms may develop, including lack of energy and increased fatigue. Frequent respiratory infections, unintended weight loss, swelling in the ankles, feet, or legs due to fluid buildup, bluish discoloration of the lips or fingernail beds due to low oxygen levels. COPD exacerbations are periods when symptoms suddenly worsen and may require additional medication or even hospitalization. These flare-ups are often triggered by respiratory infections, air pollution, or other irritants. The primary cause and risk factors. The overwhelming cause of COPD, particularly in high-income countries, is long-term exposure to tobacco smoke. Smoking cigarettes, pipes, or cigars significantly damages the lungs and is the leading risk factor for developing COPD. The more a person smokes and the longer they smoke, the greater their risk. Exposure to secondhand smoke also increases the risk. However, smoking is not the only cause. Other risk factors for COPD include exposure to air pollution. Long-term exposure to indoor and outdoor air pollution, including fumes from burning biomass fuels used for cooking and heating in poorly ventilated areas, can contribute to COPD. Occupational exposure, exposure to dusts, fumes, and chemicals in the workplace, can also cause COPD. Genetics. A rare genetic condition called alpha-1 antitrypsin deficiency can make some individuals more susceptible to lung damage and lead to COPD at a younger age, even if they don't smoke. History of respiratory infections. Frequent or severe respiratory infections in childhood may affect lung development and increase the risk of COPD later in life. Asthma. While distinct from COPD, having asthma may be a risk factor for developing COPD, particularly in individuals who also smoke. COPD is typically diagnosed based on a person's symptoms, medical history, and a breathing test called spirometry. Spirometry measures how much air your lungs can hold and how quickly you can blow air out, helping to assess the degree of airflow obstruction. Managing COPD, a multifaceted approach. While there is no cure for the lung damage caused by COPD, effective management can significantly improve symptoms, slow the disease's progression, prevent exacerbations, and enhance quality of life. Management involves a combination of medical treatments, lifestyle changes, and supportive therapies. Quitting smoking. This is the single most important step anyone with COPD who smokes can take. Quitting smoking can slow the rate of lung function decline, reduce the frequency and severity of symptoms and exacerbations, and improve the effectiveness of medications. It's never too late to quit, and support is available through smoking cessation programs, nicotine replacement therapies, and medications. Avoiding secondhand smoke is also crucial. Medical treatments. Medications are used to help open airways, reduce inflammation, and manage symptoms. These are often delivered via inhalers, which allow the medication to go directly to the lungs. Bronchodilators. These medications relax the muscles around the airways, helping them to open up and make breathing easier. They are available as short-acting bronchodilators, long-acting bronchodilators, inhaled corticosteroids. These medications reduce inflammation in the airways. They're often prescribed for individuals with more severe COPD or those who experience frequent exacerbations, usually in combination with long-acting bronchodilators. Combination inhalers. Many inhalers combine 2 or 3 different medications into a single device to simplify treatment regimens. Other medications, depending on the severity of COPD and individual needs. Other medications may be prescribed, such as oral corticosteroids, antibiotics, or other types of bronchodilators. Pulmonary rehabilitation. This is a comprehensive program that includes exercise, training, education about COPD, nutrition counseling, and psychological support. Pulmonary rehabilitation can significantly improve exercise tolerance, reduce shortness of breath, and enhance overall quality of life. It helps individuals with COPD learn how to manage their condition more effectively and stay as active as possible. Lifestyle changes. Several lifestyle modifications can help manage COPD symptoms and improve well-being. Regular exercise. Although it may seem difficult when you're breathless, regular physical activity is very beneficial. Exercise can strengthen the muscles used for breathing, improve endurance, and boost overall fitness. Your healthcare provider or a pulmonary rehabilitation program can help you develop a safe and effective exercise plan. Healthy eating. Maintaining a healthy weight is important. Being underweight can weaken respiratory muscles, while being overweight can make breathing more difficult. Eating a balanced diet and staying hydrated can help maintain strength and energy levels. Eating smaller, more frequent meals may be easier if breathlessness makes eating large meals difficult. Avoiding lung irritants. In addition to smoke, try to avoid other irritants, like air pollution, strong fumes from cleaning products or perfumes, and dust. Managing breathlessness. Learning breathing techniques, such as pursed-lip breathing, can help manage shortness of breath and reduce trapped air in the lungs. Energy conservation techniques can also help manage daily activities without becoming overly breathless. Clearing airways. Techniques like controlled coughing and staying hydrated can help loosen and clear mucus from the airways. Vaccinations. Individuals with COPD are more vulnerable to respiratory infections, which can trigger severe exacerbations. Getting vaccinated against influenza and pneumococcal pneumonia is highly recommended to reduce the risk of these infections. Staying up to date with other recommended vaccinations, such as the COVID-19 vaccine, is also important. Oxygen therapy. In more advanced stages of COPD, blood oxygen levels may be low. Supplemental oxygen therapy can help improve oxygen levels, reduce shortness of breath, protect organs from damage, and improve the ability to function. Oxygen is prescribed by a doctor and delivered via nasal prongs or a mask from an oxygen tank or concentrator. COPD Action Plan. Similar to an asthma action plan, a COPD action plan is a written guide developed with your doctor. It helps you recognize when your symptoms are worsening and provides clear instructions on what steps to take regarding your medications and when to seek medical help. Improving quality of life with COPD? Living with a chronic condition like COPD can be challenging, but with effective management, it is possible to maintain a good quality of life. Beyond medical treatments and lifestyle changes, focusing on emotional well-being is also important. Anxiety and depression are common in people with COPD, and seeking support from healthcare providers, support groups, or mental health professionals can be beneficial.